Good evening, and welcome to the COVID-19 Forum, sponsored by the leadership and membership of the Strangers Rest Baptist Church, located at 2052 North 5th Street in Kansas City, Kansas. I am Reverend Jimmy Banks, pastor of Strangers Rest, and tonight we are proud to sponsor this forum entitled Real Talk, Real Answers. We'll have questions, answers, and information regarding COVID-19 and the available vaccines. We all know what COVID-19 is and the devastating effect it has had worldwide. The statistics are staggering and growing worse each day. The question may be asked, why is Strangers Rest doing this? Well, the church is responsible for spreading the gospel, the good news of Jesus Christ. This is the gospel related to managing and decreasing the spread of COVID-19. And there is good news. We have valuable information we can share to aid in this effort. The forum will be moderated by Dr. Geraldine McGee, Clinical Professor and Vice Chancellor for Diversity, Equity, and Inclusion for the University of Kansas Medical Center. Dr. McGee has assembled a group of subject matter experts on COVID-19, its impacts, and they will share information about the ways and means available on how to deal with it. World history is filled with other diseases, epidemics and pandemics like leprosy, bubonic plague, smallpox, influenza, cholera, Black Death, and Ebola, which we and the world have endured, minimized, and in some cases even eliminated. This has been done through creativity, medical scientific ingenuity, and other gifts from God. Today, we are social distancing, hygiene cautious, isolating, developing vaccines for ourselves, our families, and our communities. The fact is, friends, the pandemic won't last forever. All we need to do, however, is to unite in our preparation and our persistence. Our panel tonight will provide valuable information which will help us to do this. And now, let me introduce our moderator, Dr. Geraldine McGee, a member of executive management at the University of Kansas Medical Center, and she's also a native of Kansas City, Kansas, and coincidentally came up through this church. Dr. McGee holds a BS degree from Xavier University of New Orleans with master's and doctorate from the University of Kansas. She has a history of distinguished leadership in practice and academic settings, as well as a myriad of other areas of specialty and knowledge. She is a published author and has delivered numerous speeches and addresses locally and nationally. Without further ado, let me bring to you Dr. Geraldine McGee.
Thank you so much, Reverend Banks. Hello, everyone, and thank you for joining us this evening. As Reverend Banks said, I am Geraldine McGee, and I will be moderating the forum for us this evening. Before we officially get started, I want to let our tech team know that I think there are a few individuals who are panelists who may be in the attendee section. Crystal Lumpkins, Aaron Corbo, Alan Greiner, and Manuel Solano. If they are in the attendee section, could you please promote them to panelists, as we will be introducing all of them in just a second. So tonight we have a panel of experts from their respective areas to help answer your questions about COVID-19 virus and vaccine. We are not here to persuade you to do anything. However, we are here to provide clarity, give you the facts, answer your questions, but most importantly, we are here to demonstrate how much we care about you. We hope you find tonight's information helpful. Tonight's event will focus on addressing the pre-submitted questions from the community. There will also be a question and answer session at the end where we will be able to answer those questions that come through the chat. However, we will be talking about some really important things through the pre-submitted questions, and if some burning questions come through the chat, we will certainly try to address them at that time. I am pleased to welcome our panelists, and we will take a few minutes so that they can tell you their name, their profession, where they work, and what their experience is with COVID-19. And I will call them by name. Let's start off with Nicole.
Thank you so much, Dr. McGee. Again, my name is Nicole Garner. I work for Wyandotte County Health Department. I am the Operations and Planning Manager, but prior to that, I was the COVID Project Manager, so have lots of experience working with COVID-19. Thank you so much, and I'm happy to be here today.
Thank you, Nicole. Dr. Margaret Smith.
Hello, and thank you for inviting me. My name is Margaret Smith, and I am a family physician at the University of Kansas. And my experience with COVID-19 is taking care of patients in our hospital on the inpatient unit with COVID-19, and also having a daughter who is a nurse who got COVID-19 through her practicing her profession. So, again, thank you for having me.
Thank you, Margaret. Dr. Jason Glenn.
Thank you, Dr. McGee. Good evening. My name is Jason Glenn. I am an associate professor in the Department of History and Philosophy of Medicine at KU Medical Center. And I have also been helping with the Unified Government Health Department planning and prioritization for the COVID vaccine. And I'm glad to be here tonight and speak with you all.
Thank you, Dr. Glenn. Dr. Castro.
Good evening, and thank you for having me be part of this wonderful group. Thank you, Pastor, for the invitation to join you tonight. I find it an honor and a privilege to participate in this forum because I'm relatively new to KU. I've only been here a year. I'm the Chief of Pulmonary, Critical Care, and Sleep Medicine at KU Medical Center, and also the Vice Chair of Clinical and Translational Research. I am leading quite a few of the, or involved with quite a few of the COVID treatment studies, as well as vaccine studies that we're conducting here at KU with our partners in the region. So I'm privileged to share that information with you all and look forward to our discussion tonight.
Thank you, Dr. Castro. Ms. Mariana Ramirez.
Hi, Geraldine, and thank you so much for the invitation, and thank you, Pastor. Really appreciate it. Mariana Ramirez, I'm the director of the Juntos Center for Advancing Latino Health at KU Med, and my involvement with COVID has been through our center. We have been informing the Spanish-speaking community with information related to COVID testing, COVID vaccine, and we have also been supporting Dr. Castro with the trials related to the COVID vaccine and treatments, and also with the Health Equity Task Force in Wyandotte County, having working with them since the pandemic started, focusing a lot on pop-up testing in the community, but many other things related to COVID. Thank you.
Thank you so much. Dr. Crystal Lumpkins.
Good evening, everyone, and thank you, Pastor Banks and Dr. McGee, for this incredible opportunity. Again, my name is Crystal Lumpkins, and I'm an associate professor in the Department of Family Medicine and Community Health Research Division. I have the honor and opportunity to work with faith-based organizations in the bi-state area, and actually am conducting a study with a colleague from KU Lawrence, Dr. Yvonne Chen, with interviewing faith leaders and pastors about COVID-19. And also have an opportunity to lead a collaborative called Faith Works Connected for a Healthy Community, which is a part of the KU infrastructure, specifically the KU Cancer Center. So again, just really excited to be a part of this conversation and addressing COVID-19 and how we can move forward.
Thank you, Dr. Lumpkins. We have decided that all of us will be going by first names for the rest of the evening. So we will be removing Dr. and Ms. and all of that to be more relatable to everyone who is attending tonight. So thank you to all of our panelists. Before we get started with the questions, we thought it well to provide an overview of COVID-19 cases in Wyandotte County. Nicole Garner from the Wyandotte County Health Department will review the data for us. I also want to bring attention to, we have American Sign Language interpreters who are available for us, as well as for our Spanish speaking attendees. You can click on, it's a little bit of a circle or a globe down at the bottom. If you click on that and click on Spanish, you will have a Spanish interpreter available for you, and we will have that throughout the session. Nicole, I will let you take over.
Thank you so much, Geraldine. Well, let's go ahead and get started. So when we look at the cases here in Wyandotte County, currently we have 15,735 confirmed cases and 855 confirmed cases currently as of January the 12th. When we look at the rolling average, at the highest point in the pandemic, we had 140 cases per day. Currently, we are sitting at 104 cases per day. And at the lowest point in the epidemic, we were at 10 cases per day. I often get asked the question, is Wyandotte County a hot spot, or how critical is COVID here in Wyandotte County? So I provided this COVID-19 comparison, and we're looking at New York City, Dallas County, as well as Harris County, which actually is in Houston. And when you can see the case rate per 100,000 compared to New York, Dallas, and Harris County, which is in Houston, Texas, you'll see that the case rate per 100,000 is almost double in some cases in Wyandotte County. When you look at the death rate per 100,000, you'll see that in Harrison County, 58 compared to 124, as well as in Dallas County. And so the question is the pandemic serious here in Wyandotte County? Yes. When we look at cases by race and ethnicity, you'll see that 15.3% are in fact Black, 60.4% are white. And I wanted to actually use this comparison when we look at the confirmed cases of ethnicity. You'll see that 36.7% are in fact Hispanic. And so that puts that 60.4% number into perspective. When we look at the COVID cases by age, you'll see that 20.2% are in fact have the most cases up here in Wyandotte County. When we look at the confirmed cases by sex, it's pretty even, although females are slightly higher at 54% compared to 46% for male. When we look at the COVID deaths here in Wyandotte County, 32.2% are in fact Black, and 52.4% are white. But again, I wanted to provide the deaths by ethnicity, and you'll see that 18.8% are Hispanic, and then that non-Hispanic is 79.3%. When we look at the COVID deaths by age, you'll see, unfortunately, that there's a wide variety of people here in Wyandotte County that in fact passed away. But the majority of the cases here in Wyandotte County are between the ages of 70 and 89 years old. If you remember in the news a few months back, we had a lot of cases at the nursing home in River Bend. And so this is reflected of those deaths that happened in River Bend. And so let's take a quick, I wanted to kind of put things into perspective as far as the impact of COVID-19 in Wyandotte County. Currently, right now, the current population that is affected by COVID is 10%. But when we, if people I know that a lot of people are saying, I want to wait to get vaccinated, and my job is not to persuade anyone to get vaccinated. However, what will happen is based on our rolling average, we could reach up to 65,000 cases or 39% by the end of 2021 if we don't start aggressively vaccinating people here in the community. So what does that really mean? 1 in 4 people could be affected by COVID-19 here in Wyandotte County by the end of the year if we don't aggressively start vaccinating. So where can people actually get tested? Currently, we have our Kmart site, which is located at 78th and State. We are testing people for COVID between the hours of 9 and 3, Monday through Friday. If you want to know where you can get tested, if you want to know where you can get tested also in the community, you can actually access this link bit.ly/YCO COVID testing. And so we offer pop-up testing throughout the community as well. And so our vaccination. So currently right now, we have vaccinated at our Kmart site, 2,485 people. We are currently still in the first phase, and who actually has been vaccinated. Currently, we have vaccinated healthcare associated workers, EMS staff, health department staff, our staff of long-term care facilities, and a select government employees in critical vaccine program. This is actually a slide that ended by KDHE, and it's most recent as far as our prioritization. Right now, currently, we are still in phase 1. We will be transitioning into phase 2, and that will be persons age 65 and older, people that are in congregate settings, high contact critical workers, as well as people that haven't been vaccinated in phase 1. And so where can you be vaccinated at, or how do you sign up to be vaccinated? There's a couple of different ways. The first way is to actually reach out to your employer if you are in fact a healthcare employee or provide direct patient care. And you can actually access this link at bit.ly/healthcare vaccines. If you are not a healthcare employee, if you're a person who is 65 years of age or older, you can actually access this link, which is bit.ly/YCO vaccine form. There you can actually fill out the form. Once you fill out the form, you will receive a number of updates as to when it would be your turn to be vaccinated. That is all. Thank you.
Thank you, Nicole. Thank you for that really important data that you just provided, the overview of Wyandotte County and COVID cases and how important it is for us to consider the vaccine. Before we go any further, we do have Alan Greiner, Aaron Corvo, thank you, and Manuel Solano, who are in the, I believe, attendees section. So if we could upgrade them to panelists, that would be great. Aaron, I will have you go ahead and introduce yourself real quickly.
Hi, thank you, Geraldine. Hi, everyone. Thank you for the opportunity to join you this evening. It's a real pleasure. My name is Aaron Corvo. I'm the Deputy Health Officer at the Unified Government Public Health Department. And so I've been working really since the first days of this pandemic on all things COVID related in Wyandotte County, which has been a real privilege, I think, to get to know the community in this way. I'm also a doctor at KU Medical Center in the department with Dr. Smith and Dr. Greiner, who you'll hear from. I'm a family physician. I work in the hospital and in the clinic there. So thank you, Geraldine.
Absolutely. Thank you, Aaron. I think also is coming Alan, as well as Manuel will be entering soon. So Alan, I want to give you the opportunity to introduce yourself as well.
Great. Thank you, Vice Chancellor McGee, and thank you, Reverend Banks, and all the attendees for being here tonight and coming out and showing your interest in this important topic. It's a pleasure to be here. I'm Alan Greiner, family physician, just like Dr. Corvo, in the Department of Family Medicine at KU Med Center, and Dr. Smith, and then also the health officer at the Wyandotte County Health Department, and have been involved in this COVID activity from the very beginning, and hoping that we can share some information that'll help you keep yourself, your families, and your community safe. So thank you.
Thank you, Alan. And Manuel, we'll have you introduce yourself, tell us your name and your profession and where you work and your affiliation with COVID-19.
Okay, hi, I am Manuel Solano. I have a background of MD and educator, and I work I am a program director for the Wyandotte Health Council and the Community Health Council of Wyandotte County. I'm sorry for the name. And I have been involved with COVID-19, supporting everything that is related with the pop-up testing with Mariana and the team in there, and anything that is related with social determinants of health and the support that people with COVID-19 need, trying to help them within their needs.
Thank you. Manuel. Yeah, thank you. So most of the questions this evening are about the vaccine. However, there were a few questions that came in about the virus and personal protective equipment, but also some really other interesting questions that we feel were really important to address. So we are going to actually get started with those questions. And the first one, I am going to direct to Margaret, Manuel, and Jason. And if the three of you could kind of tackle this question and give your quick thoughts about how to address this, that would be great. The question says, a recent story has circulated online about a Black doctor who had a chronic condition, dying from complications due to COVID-19, with biases in the healthcare system being an attributing factor. Disparity in healthcare still seems to be unrecognized by many. If a doctor could not advocate on her own for her own care, how can we trust that we are being told about what we're being told about the vaccine? And how do we advocate for ourselves when we're in the hospital? Jason, do you want to start with that one?
Sure. And thank you for the question. You know, health inequities unfold on a number of different levels. And when we talk about the health inequities that occur during the encounters with healthcare workers, one is in the decisions that get made when healthcare workers are presented with a patient who is from a community of color. But another is the persistent reports from people of color that their healthcare complaints aren't taken as seriously as those of other patients often. We see this in the data related to all manner of things, particularly in pain management. You know, there's just always an assumption that or often an assumption that people of color, their health complaints aren't as serious as they truly are. And so often folks of color have find ourselves in a position trying to manage the impressions that health workers have of us to make sure that they take our health complaints seriously. And that's something that, you know, many of us have all gone through, and it doesn't matter what your education level is, what your class level is, what your income is. You may find yourself in that position having to try and manage the impressions that health workers have of you in order that they take your health complaints seriously.
Thank you, Jason. Margaret?
Yes, thank you also for the question. And I agree with Jason. Health inequities are still a part of our healthcare system. And as he said, it doesn't matter about your education or your social standing. This is something that we all have to deal with, and it's something that all of us together have to work to overcome in our healthcare system in the U.S. And what you can do is make sure that you are educated as much as possible. Make sure that you look at reputable internet sources like the CDC to find out your information. Wyandotte County Health Department is another good place to get information from. And the other thing that I would advocate for is that you find a primary care physician that you trust who will partner with you to protect your health and to be an advocate for you along with yourself.
Thank you, Margaret. Margaret knows I trust her, and I have sent her a lot of patients. So when people ask for recommendations, I do send them to Margaret, and she accepts them when she can. Manuel, would you like to add anything to this section? Manuel, you're on mute.
Okay, I'm sorry.
Okay.
I thank you for the question. And if you haven't watched the video, I strongly invite any of you and all of you, all the participants, to watch the video. It's a reality. There is something that is embedded in the system. And the main problem that we are seeing in there is that unless we change the system, the bias is going to be there. And organizations are starting to address that particular bias. The thing is, they are not only addressing this from the good of their hearts. The system is changing from fee for services to value-based system. So now it is important not to have different outcomes. Just because we are a minority, we have the right to have the same outcomes that anybody who is not a minority. Therefore, the measures of quality and the outcomes have to be the same. Now that the Congress and everything is making everybody accountable for equal outcomes, we are starting to talk about this. But please look and watch the video. That is very, very telling. And it broke my heart too. Thank you.
And well, which video is that again?
Is Dr. Susan Moore. It is in the news. She is a physician who was hospitalized in Indiana. She was complaining about a lot of pain, exactly what Jason mentioned, and nobody put that much attention to her. And finally, she succumbed to COVID-19 in December 2020. So please, I strongly recommend that. It's all over the news. You just type her name, Indiana, COVID-19, and you will find it.
Okay, thank you, Manuel. I'm going to move on real quickly to our next question. The question says, what are the top 5 reasons COVID-19 has negatively impacted people of color, especially African Americans, Latinx community? And I'm going to add in there our Native American, American Indian community, because we also know they have been impacted by COVID-19 as well. I'm posing this question to Jason and Mariana, and if y'all could answer that as I want to say quickly, but I know that's a hard thing to do when we talk about why it is impacting people of color. But if you could address that real quickly, that would be great. Mariana?
Sure. Thank you for including our Native American populations. I think indigenous people, our Black communities, and Latinos, we just historically have lived shorter lives and sicker lives. Earlier this year, the CDC released a report with death rates from late January to early October in 2020. And that analysis showed that close to 300,000 deaths. There were more deaths than the typical number during that same period in previous years. And 2 of 3 of these excess death rates were related to COVID. The largest percentage increases were among those who were Hispanic and adults aged 25 to 44. And sadly, this is not a surprise, Geraldine. This inequitable context is not a mystery. In 2019, 53 million US workers were employed in low-wage jobs, earning a median hourly wage of $10. And however, a 2017 analysis showed that the 3 wealthiest people in the US, Gates, Bezos, and Buffett, own more wealth than the entire bottom half of the American population combined. And this is when 20% of US households, including 30% of Black and 20% of Latino households, have 0 or negative net worth. The US Census Household Pulse Survey also found that 44% of Black, non-Hispanic, and Hispanic households reported they had no or little confidence that they could pay the next month's rent. This is more than twice than the already alarming 20% of the white population. Food insecurity, same story, was reported by 20% of Hispanic and 26% of Black households versus 9.3% of white households. These inequities are avoidable, unjust, and they are preventable. If I have to pick 5 causes, they are all related to these, to inequities, poverty, crowding. We Latinos are overrepresented in essential worker occupations. We have lower income and less access to paid sick leave, which should be a universal right. We live in overcrowded conditions, have lower access to healthcare coverage, and many, because of their immigration status, are excluded for any federal help, including the stimulus check assistance.
Great, thank you, Mariana. That's really good information. Manuel, it looks like in the chat, they're wondering if you could provide a link to the video. So if you could maybe, or someone could locate one and provide it to the panelists and attendees, that would be great so that they can click on that link. Jason, is there anything you would like to add to what Mariana just stated?
Yeah, she broke it down pretty good. It's hard for me
Okay.
to, but I will say, you know, just to compliment, people of color are the bulk of your frontline workers in many industries like nursing, public transportation, agriculture, food production. And these are the industries that have a lot of close contact with the public and also with your fellow coworkers. And they put people of color at an increased risk of coming in contact with the virus. Also, as Mariana said, communities of color suffer from higher rates of poverty and structural racism. And those contribute to higher incidences of comorbid conditions that COVID just seems to love to eat up, like obesity, cancer, diabetes, lung diseases, and hypertension. And those, second only to age, are what puts you at greatest risk of dying from the disease. Living in resource-poor communities can also delay one's ability to get hospitalized if they develop a more severe form of the disease. Also, we know from broader health inequities research that health complaints, like I was saying earlier, aren't always taken as seriously by healthcare workers when people of color present with them. And then finally, this is more specific to folks in our Latinx communities, that one of the consequences of the last 8 years of increased deportations is that some members of Latinx communities delay seeking healthcare in general for fear of being profiled as undocumented, whether they are or not, or if they have a family member who may be. And those issues all combine to make for a perfect storm in terms of how COVID-19 has been impacting us and our communities.
Thank you, Jason. Thank you very much for that. I'm going to shift real quickly to Aaron. I have two really quick questions to ask you, and then we're going to move on to questions about the vaccine. So Aaron, someone wants to know, what type of mask provide better protection? Is it the cloth mask or is it a disposable paper mask? Which one is it, Aaron?
That's a good question. You know, actually, I think these masks right here, these little paper masks, these disposable paper masks are really, really great. And they're, we think, a little bit better than the cloth masks. But that's not to say that the cloth masks don't also help a lot, actually decrease the spread of COVID. So imagine that you've got a cloth mask. Now we'd like it to be 2 layers at least, and some of them have those little filters in the middle. Those are great. So those are really good enough, I think, to wear out into the community. And if everybody had those on, we would really decrease the spread. These, we think, work a little bit better. I wear this in a clinical setting when I see my patients, you know, these little cloth masks. And the real key is to get it tight around your nose, pinch it down, tight under your chin. We don't want much airflow there. I mean, enough to breathe, that's it. And so I hope that helps. Those N95 masks are the best, but we don't need those out in the community. A cloth mask will do, or one of these will be great.
Absolutely. And one of the tricks I learned for those of us who wear glasses is when I do have on the mask that you just showed, Aaron, I twist the side and then put it behind my ear, and it helps to prevent that fogging of the glasses for those of us who have 4 eyes. It helps us a lot. So yes. So Aaron, another question real quick. Which one is better for the COVID-19 test? Nasal swab or saliva? Which one?
That's actually a bit of a tougher question. I will say that both of those tests are really good. I think because both of those tests are PCR tests. So what does that mean? You know, they're not those fast tests. They're the ones that you do, and then you've got to send them to the lab, and they take a day or 2 to come back, the results. Both of those types of tests are great. As long as we've got some indication from the FDA that that test is approved, we would trust that result. So For instance, in Wyandotte County, at the health department, we've used the nasopharyngeal swab, which is way back in the back of the nose. That is the gold standard. We think that this virus really, when it's starting out, really replicates in the nose there. But the saliva tests have also proven to be really good as well. We've been doing a lot of spit tests, for our schools in Wyandotte County and in the community, and we think those are really good. It really depends on the lab and how the equipment is calibrated and all of that. But I just want to say, if this is a PCR test, that is a gold standard. The nose, the mouth swab, those things are good. So.
Great. Thank you, Erin. So now I'm going to shift to questions about the vaccine. But before we get started, Jason, I have a question for you. Concerns about the vaccine from people of color are not without merit. Can you talk to us about why there is so much mistrust in the community and where that mistrust stems from people of color? And I'll let everybody know that I did send Jason a little idle threat earlier because he is a walking library, and he is a historian, so he will talk forever about this. But Jason, I'm going to let you talk real quickly about the mistrust and where does that stem from?
So, actually, unfortunately, there are many communities that have reasons to be mistrustful of the biomedical industry, and those are grounded in histories of exploitation and abuse. Up until reforms during the civil rights movement, slaves, orphans, disabled children, poor people of color, and mainly prisoners are victims to untold numbers of atrocities in service of biomedical research. Also, to this day, poor people of color continue to suffer multiple health inequities in virtually every realm where we measure it, from infant mortality, maternal mortality, cancer, diabetes, hypertension, heart disease, asthma, you name it. What's more is that these inequities cannot be reduced to differences in class, education, geography, or where you live, whether you have insurance, or even reduced to genetics. These inequities stem from structural racism in society that puts extra wear and tear on our bodies, and then also stem from individual racism in the clinical setting that plays out in terms of the decisions that get made with patients of color. Some of these inequities, which began to see improvements in the 1970s and 80s, have begun to get worse in the 1990s and 2000s. So despite having a little bump where we were improving, now we're going back down. But despite that history, I do not think that this vaccine poses a specific danger to communities of color. For starters, the usual suspects that I just named were not exploited as the main guinea pigs in the development of the various vaccines making their way through the approval process. Second, and I have to just state this bluntly now, we have the advantage that a lot of rich white folks got to go first in getting the vaccine because of the government's prioritization guidelines that privileged healthcare workers, right or wrong. So we can look at them, see that they're doing okay, and know that it's relatively safe. There are a couple of unknowns about the vaccine, how long it protects us from the virus. Also, or beyond the 8 months that, have been studied in the initial studies that are coming out and being reported to the FDA, and then also possible long-term consequences. However, we're all in that boat together. We are measuring what is happening to folks across the nation, across the world, as they take the different vaccines. And I have every faith that if we are seeing any untold side effects, that those will be caught. The bigger danger I fear for our communities is that even though we have a greater risk of dying from the virus, that communities of color, particularly poor communities of color, may be the last to receive the vaccine, not only due to the usual ways we get discriminated against, but possibly compounded by all the vaccine misinformation that's floating around out there. That's why my colleagues and myself are here tonight to provide some credible information to help folks make the best and most informed decision that doesn't skirt around the untoward parts of our histories of exploitations and abuse, but also puts the truth out there in terms of identifying when there's real reason to have fears and skepticism and when there's not.
Great. Thank you, Jason. So Mario, I am now going to come to you because you are a physician and you are also a scientist running clinical trials related to COVID-19. So I have a question for you. One of the questions says, should I be concerned that the development of the vaccine was rushed? What are your thoughts about that? Should we be concerned?
Thank you for that question. So the approach in the US has been through a unified approach across a number of federal and state and local agencies called Operation Warp Speed. Operation Warp Speed has been operating since very early in this pandemic to try to push forward our science in terms of the development of the vaccines and getting it ultimately to injections out to folks to help us combat this pandemic. I wish almost didn't was called Operation Warp Speed. I think there would have been maybe other safer or more trustful terms to talk about it. But it is conveying that this approach has enabled us to do something we've never seen in our lifetime before. We have not ever had a pandemic, an infection like this, where we've been able to detect the vaccine. The molecular structure of the infection was just released at the end of January. And we are here as of recently over, I believe in the CDC website, over 19 million, I'm sorry, close to 10 million people have been vaccinated in the US. There are a lot of doses of the vaccine out there. I think there are over 20 million, 29 million, but so far we've gotten to 10 million. That is unheard of. We've never been in any situation here that we've ever had that kind of a success. To your question, is it safe? Well, I can tell you here in the US, through the National Institutes of Health, these trials have been conducted together with the sponsors, the pharmaceutical sponsors, the AstraZenecas, the Johnson & Johnson, the Pfizers, and so on, in partnership. And so we've done this with the most rigorous methods. The same thing that I use in my other patients for asthma medications, the same clinical trial structure where you go through phase 1, phase 2, and then phase 3 has been our approach with the vaccines. We have not skipped any of those steps. We have been very careful in reviewing every case, where there's concern about somebody that got vaccinated. That happened to me with our AstraZeneca trial. We were delayed for 2 months while we were reviewing a case that happened in the UK after receiving the vaccine. When we get that new information, it's conveyed to our participants in the clinical trials. It's part of our informed consent right now. So I do think that it has been amazing to me as a physician and physician scientist how fast we've been able to push this and get it into the arms of people that need it. But if there's any time that we needed to be fast about it, this is the time that we had to do it. And the other amazing thing to me as a physician scientist is that this will change our approach to how we combat infections in the future. There are things we have struggled with. HIV is another example where it took a long time to get the right medications to the right people, and we shouldn't be that way. We should be at Operation Warp Speed with every of these illnesses, especially those that are disproportionately affecting our communities. And we should be doing it with the right science behind it. And I believe that we have been pretty transparent about all the the vaccines that are out there. You can go to the CDC website. You can go to the New York Times. Up-to-date information about every one of those vaccines is available there to the public.
Mario, someone wrote, they said, I do not believe the new variants have been considered. Should I just wait to get the vaccine until the variants have been considered? Or will the vaccine that is now being distributed be able to cover the new variant of the virus?
Yeah, so this is part of the problem. As we go into this pandemic and variants will emerge, we'll have unanswered questions like that. And truly, that question has not been answered. Will the vaccine be effective with the new variants that we are seeing that started in the UK, spread to South Africa, and are now present in the US in over 10 states? We do know there's some preliminary data coming out just this past week where they have tested people that have had the new variant infection and have had the vaccine, and it does appear to be effective in those patients that have had this variant. These are very small numbers, very preliminary data. But at this point, what we know based on the vaccine and how they are made, how the molecular structure is of these variants, we believe that the vaccine will protect us even with the new variants, as well as the monoclonal antibodies. But one thing we've learned a lot about viruses is, unfortunately, they're very smart buggers. they mutate. And so this is going to require ongoing surveillance for these mutations to make sure that we can continue to protect the health, our public health, our people in our communities.
Thank you, Mario. And I have another question for you, Mario. And then Jason, I know you wanted to add something real quickly to what Mario just said.
Yeah, it was about the concern over the speed. And just to tell part of the story that Mario did mention, that this is actually a love story that occurred over 30 years. The messenger RNA technology in the Moderna and the Pfizer vaccine was developed by a Turkish couple who, are the CEOs of BioNTech. They met in graduate school and fell in love in Germany over the cause of trying to help improve cancer treatments. The idea was to use the messenger RNA technology to try to trick the body into recognizing, threats earlier before one was actually introduced. And I think it's actually a really sweet story that, this couple who's been working on this for 30 years, absolutely in love, found themselves the right place and the right time to apply that technology to the coronavirus. So, it's not something that we just were able to miraculously do in a year. We were able to mobilize existing work that, folks did over the past 30 years. And that is also a miraculous part of the story, and people should know.
Great. Thank you, Jason. We've actually been studying SARS-CoV-2 since early 2000s. And so people think it's a rush on the vaccine, but really we've been studying it for years and trying to address SARS viruses. Mario, question for you. What is the science behind the vaccine related to age or any underlying illnesses, if you have that information regarding diabetes, cancer, high blood pressure?
Sure. And age is probably the best studied so far. Each of the currently emergency use authorization vaccines, the ones made by Pfizer, BioNTech, and Moderna, have now published the results in the elderly, have shown that the vaccine is efficacious in those above age 65. So we're pretty comfortable now in moving into the elderly population. And in the state of Kansas, as you know, those in the nursing homes, extended care facilities are in that first phase to be vaccinated. Comorbidities, so things like diabetes, underlying immunosuppression. The patients that have underlying comorbidities have been actively enrolled into the vaccine that are currently available, and they're actively being enrolled in our study here in Kansas City by AstraZeneca. we don't have much data yet on those subsets from those studies. What we do know is that it does appear to be protective to those with those comorbidities, like diabetes, heart disease, and so on. Unfortunately, the immunosuppressed, so those patients that we treat with, that are on treatment or are receiving chemotherapy, were excluded from the trials. And you may ask why. Well, the reason is that in order for the vaccine to work, you have to have an intact immune system. You have to build antibodies. And so the companies couldn't start with that group of patients because that would defeat the whole purpose behind it. So we are entering into the kind of subsequent phases of studying these vaccines. We are just getting ready to launch the pediatric studies. We're getting ready to launch studies of women that are pregnant. And we're also getting ready to launch studies in patients that are immunosuppressed. And then we'll have more detailed information on those subsets that you mentioned, Geraldine. But I have my own mother that's undergoing chemotherapy, and I can tell you, as soon as she can get the vaccine, I'm going to get it to her.
Okay, all right. Thank you, Mario. Okay, so Alan and Aaron, I've got some questions for you.
Chemotherapy, and I can tell you, as soon as she can get the vaccine, I'm going to get it to her.
Okay. Are you all hearing that, or is that just Mario? Okay, so Alan and Aaron,
We're hearing it.
Okay. Okay, here we go. Alan and Aaron, which vaccine should I take, Moderna or Pfizer? Do I even get a choice on which one I get?
Take it, Alan.
That's a great question. As of right now, we really don't have the ability to offer a choice. And I think those of us working in clinical medicine and public health would say, if you have the opportunity to take one of these vaccines, you should probably do it. We've got a lot of data on safety and efficacy now, more and more every day. These two vaccines, Pfizer and Moderna, use the same technology that Dr. Glenn mentioned, the messenger RNA technology. We think it's safe and effective. So I would say jump right in there. And I think as we get other vaccines, we're going to find that they're safe and effective too. And we're going to need to probably use everything that the FDA can evaluate and determine is safe and effective to get this pandemic under control. So I would urge you all to work with those you know in your families and communities to get across the idea that we're going to have to take what we can get to get our lives back to normal. And I think we got to work together on that.
Absolutely. Thank you, Alan. Aaron, there's also part of this question that says, if the vaccine is mishandled because it must be kept cold, will it be ineffective if it's given to someone?
Well, I suppose it could be, but I do want to assure people out there in the community that the handling is being, really closely monitored. So for instance, at the health department, we've obtained really those super cold storage freezers, and that is for the Pfizer vaccine. And certainly all of our hospitals, have these ultra cold freezers where those vaccines are stored. There's a few days that those can be thawed and used, and then after that, we throw it away if it's not used. And so we have to be very careful. The other vaccine, the Moderna vaccine, is refrigerated. And so it's a little bit easier, in terms of storage and such, but we have room for those refrigerated doses as well. And I just want to assure the public that we take this stuff really seriously all through the shipping period of time. And then when we have the vaccine and such, we have the temperature is very closely monitored on the vaccines. And then all of our staff are very well trained on how to handle the vaccines so that we can ensure that the vaccine is active and going to be good and effective for the person who gets it.
Okay, thank you, Aaron. Okay, Nicole, I have a question for you, some really important questions about the vaccine. Will everyone who wants a COVID-19 vaccination be able to get one?
Yes, they will be able to get one, and it's going to be based on the prioritization schedule. So when your time is called for, rather, you will be eligible to get the vaccine.
Okay, and how will I know when it's my turn?
There's going to be a number of ways. And right now, we really are encouraging the community to go to bit.ly/YCO vaccine form and actually fill that out. That's going to help our health department identify, especially people age 65 and older, which is going to be the next phase. So if you go there and actually fill out the form, you will receive updates as to when it will be time for you to get vaccinated. And there'll be a number of different ways, not just a phone, also newspapers. So there'll be a number of ways we will receive information as to when you can be vaccinated.
And will Nicole, can you put that information in the chat, or is there some place they can easily access that information?
Yes, and I believe at the end of the presentation, that link will be available. But again, it's bit.ly/YCO vaccine form. But it will be available.
Okay, when you get a chance, put it in the chat. But I know, because you have 2 more questions here. Does it cost, or do I get it for free?
And so that's a great question. It is not cost. We have several people that live in the community that are uninsured and underinsured. So we want to remove all those barriers. And so there is no cost to anyone that's coming to get vaccinated.
Okay. Aaron and Alan, we may have addressed this, but I want to ask it again. When will healthy seniors who do not live in long-term nursing facilities be able to receive the vaccine?
We hope very, very soon. In Wyandotte County right now, we've almost completed the first round of vaccination of all healthcare workers across the community, both those that work in hospitals and those that have not. Now, there's quite a backlog in Johnson County, so there may be some counties working together to get the healthcare workers in Johnson County taken care of in the next week or two. But we hope within a couple of weeks, we may be moving into that older adult population on our web form that Nicole just mentioned, and a couple people have posted it in the Q&A section already. If you fill that out, it also asks you if you have chronic conditions. So you can not only say that you're over 65, but you can say that you have chronic conditions as well. And then we'll be calling you in 10 days and getting people in, because we're ready to do it, and we're just hopeful that the supplies keep rolling in from the state. That's the sort of issue we'll have to watch.
Great, thank you. Nicole, will you put that where it says all panelists and attendees? That way they can see it as well. Alan and Aaron, I have another question for you. So have there been any deaths from the COVID-19 vaccine? This was one of the questions that came in. Any deaths associated with the vaccine?
Aaron, you want that one?
We don't think so. Mario, you may want to chime in as well. It's a good question. I mean, I giggle because it's a little bit uncomfortable. There was a case in the last couple weeks of a physician, I believe in Florida, who there was a big headline. The physician received the vaccine, and 2 weeks later he died of a hemorrhagic stroke. Now, it's interesting when we review the case and look at it, and by the way, it's being reviewed very carefully right now. But in our department, we think, gosh, we don't even know if it was really related to the vaccine. And I think at this point in time, it's really important to know that gentleman had a bleeding disorder, a blood disorder that was known about, and that was an underlying health condition. And that stroke may have happened whether he received the vaccine or not. We don't know all of the information at this point in time, but it's being reviewed. We want all of you all to feel safe and confident that the vaccine that you're receiving is good and safe for you. There's also been cases of people with allergies that have had serious reactions. They've had what's called anaphylaxis, where it's been difficult to breathe once they've gotten the vaccine, and we use epinephrine or an EpiPen after that, and everything's been okay. And so I want to even encourage those of you who do have serious allergies. I actually do. I have a very serious allergy and carry an EpiPen, but I've received my vaccine and did really well, and it came out okay with it. So I don't think that this needs to dissuade you all from getting the vaccine, because I just want to put out there that we are prepared. If something were to happen, a reaction, we're there. We're ready to treat you all. We've got people who know what they're doing on site to help you with any reaction should you have one.
Right.
If the others want to contribute to that question, it's an important one, I think.
It is. Anyone else want to contribute?
Yeah, we've been
Okay.
carefully tracking all potential deaths. And as you can imagine, each one of these vaccines, when they were being studied, that was being carefully monitored. And when you get to 30, 40,000 people, things happen. And so the deaths that we have reviewed so far have been attributable to other underlying causes or unrelated to the vaccine at this point. But as Aaron mentioned, there are, and this is, I think, one of our other questions I'll dive into, there are this subset of people that has severe allergic reactions. And so if you've had a severe allergic reaction to the vaccine, you should not get it. If you receive the first dose and you have a severe allergic reaction, you should not get the second dose. And those are basically the only folks that should not get the vaccine is those that have that severe allergic reaction. Now, as Aaron mentioned, there are others that have allergic tendencies. And what we are doing at the sites is we're monitoring you for a period of time after your shot. And that will hopefully, again, detect those allergic reactions that happen. But again, it's these are things that we are very used to managing as physicians and making sure that you're safe after you receive that vaccine. But we do want to have people aware that that could happen.
Okay, great. My mother sent me a text message wanting to know if children should get the vaccine. I have no idea why she wants to know this, because her children are in their 40s, but someone answer. She's probably checking for her grandkids because her children are in their 40s and she's texting me. So Aaron or Alan or Mario, should children be getting the vaccine?
Not
Go ahead,
yet.
Mario. Yep.
Only for Pfizer, it's authorized by the emergency use authorization down to 16 and above.
16 and above.
But that's it. So if you're less than 16, Moderna is 18 and above. So
thank you. So Mom, I can get the vaccine. Okay, moving on. Let's Margaret, I have a question for you. What is emergency use authorization?
Yeah, Geraldine, that's a good question. So in an emergency like we're in now, the pandemic, it may not be possible for all of the evidence that the FDA would usually have before approving a drug or a device or a treatment in order to approve that treatment or drug. And when the emergency is declared, then the FDA can make a judgment. The scientists at the FDA can make a judgment if it's worth releasing that device or treatment or drug, or in this case, vaccine. And they would review the benefits, possible benefits to the public versus the potential risk. And if the potential benefits outweigh the potential risk, then the FDA in an emergency situation can give an emergency use authorization. Now, for the vaccine, the CDC also examined the evidence and independently decided that we should release the vaccine to the public.
Okay.
And as Mario mentioned, there's ongoing monitoring and continued trials with the vaccine. So that we don't just stop when we get this emergency use vaccine authorization. We continue to do studies to make sure that it is safe and effective. And if we find that it's ineffective, then it's the treatment is removed.
Okay, I want to be mindful of our time. I do want to go until 7:15 with the pre-submitted questions and start answering some of the ones that are coming in at 7:15 through 7:25, and then we will close out with Pastor Banks. But we have some really important questions that I want to get to. Which is stronger, immunity after the vaccination or after recovering from COVID-19? And I'm posing that to Alan and Aaron.
Aaron, you want that one?
Well, I'm not sure that we know, and Alan, I want you to chime in as well here. We do think that after, if you did get COVID-19, we do think that confers some immunity. And the thing is we're not sure how long that lasts. And so we think that it is possible to actually get the virus again. We see that usually, at least 60 to 90 days, people seem to have immunity to COVID after they've fought through the virus. As far as the vaccine, my understanding at this point is we're looking back about 9 months now, and the trials are looking pretty good. People who have received the vaccine 9 months ago, they're still looking like they have immunity to COVID at this time 9 months later. So that bodes really well for the vaccine. But I think that this is a question that's excellent, and I think it's sort of a work in progress. Alan, do you want to add anything?
No, I think you covered it. I think there's a lot we're going to learn in the coming months about this that we'll have to just keep sorting through.
Okay, Mario, did you want to add something? Yep, you took your.
I would just I would just add that this is something I'm often asked is should you get the vaccine if you've had COVID? And you should. We know now it's once you're outside of the quarantine period, you should go ahead and get the vaccine. And the reason is that you can imagine there are various forms of COVID severity, right? You may just have mild sniffles. You may have a more severe, and your ability to mount adequate protective antibodies may vary. And so whereas the vaccine will give you a more consistent or robust response, especially if you get the second shot. And that's what's so important to stress to everybody in our audience is it's not one shot and you're done. It's 2 shots, and you have to get that second shot to get adequately protected.
Okay, great. Margaret, this question says, do I still need to wear a mask after I've been vaccinated? I'm going to go ahead and answer that for you, Margaret. Absolutely, yes. Everyone, please wear your mask. Okay, but that is a great question because you wonder, and so you still want to protect yourself and other people, so it is important to continue wearing the mask. Okay. Mario, real quickly, I think you just talked about some of these, but I think it's important to just mention just overall, what are the side effects from the vaccine?
Sure. So what's been pretty consistent across the RNA vaccines, but we also have been observing it with the AstraZeneca vaccine, is that majority of people will get pain, swelling, and redness right in the arm. And I'm getting my second shot tomorrow, so I'll tell you about that one later. But that, it is there, and people do feel that. And it usually is resolved within 2 to 3 days, may last up to a week. Another group will often get chills or fatigue or headache after getting the vaccine. And so you can take Tylenol, certainly after you've had that. Sometimes that helps with that reaction. And so again, that should just last a few days after the vaccine. Usually it's resolved by day 2 or day 3. We often tell our patients, just sleep it off, go to bed early and just sleep it off, and tomorrow will be a better day. Those are really the most common side effects that we are seeing across the vaccines at this point. And I mentioned earlier that there are a very small group of patients that have had allergic reactions. We just reviewed the data on Monday of those reported. And across those 10 million doses that have been given so far, only about 30 some people have had serious allergic reactions to the vaccine. So at this point, it appears to be quite rare, but that's the only serious side effects that we really need to be looking for.
Okay, Thank you. And I do want to make it clear, you probably covered this. I see a question in the chat. So you need to, when you get the first shot, you need to make sure you get your second shot as well. So you're not, are you covered at all after the first shot, or are you fully covered after the second shot, Mario?
Yeah, you are partially covered after the first shot. And so that approach is being taken by some countries is, let's see how many people out there we can get that first shot in. But here in the US, our approach is to get full immunity, full protection, at least to the best that we know with the vaccine, and both the mRNA vaccines showed efficacy of 95%, which is pretty good, pretty amazing. And as Jason mentioned, that story, that love story, which, we had no idea with these mRNA vaccines, this is brand new territory. And to get that 95% efficacy is an amazing story.
Okay, great. So the next question says, after receiving vaccination, can I give blood after I've received the COVID-19 vaccination? Alan or Aaron or Mario, Margaret?
I think it's totally safe to give blood after you receive the vaccination. What we know from other vaccines that are similar is that would pose no risk to anyone who might receive those products later.
Okay, great. So Manuel, Mariana, and Crystal, I have a question for you. There's somewhat of a stigma associated with having COVID-19 or having had COVID-19. How do we tell our community to combat that stigma that comes with that? What can we do, Crystal?
Yes, thank you so much for that question. Early on, unfortunately, last year, there was unfortunately xenophobia, just discrimination against, particular population Asians. And I think to combat that, it is education. The pastor mentioned at the beginning the spread of, I think, information, and I would say the gospel of spreading good information. And so addressing stigma, I think it's two things. For as an individual level, personally, that disease does not define you, if that's something that you have COVID-19. And then it's also empowerment. Somewhat as we've moved from a year ago, COVID-19, I think that the sting of the stigma has somewhat lessened, I believe, and not saying that it's normalized, but I think that people that are trusted individuals, say, like, for instance, there have been several Hollywood stars that have come out and said, I have COVID-19, and this is something that, and sharing their journey. And then also addressing it in, I would say, such as faith populations, working with faith populations and sharing that information and being supportive and saying this is something that, this is prevalent. And so not being ashamed, because unfortunately when individuals, they feel like the stigma is essentially something that is immobilizing, that further exacerbates the situation and basically impacts from, testing and knowing that you have a COVID-19. So I think it's a two ways. It's personally and being empowered, and then also having that support from organizations like faith-based organizations, community organizations that can share this information. One last thing that I will say, that the populations that I work with, those pastors have been very instrumental with sharing visually, maybe placing that, in social media, because we know we're not meeting in person, but incorporating that into a service. So those are some of the types of things that I can, think about as far as addressing and taking the sting out of stigma.
Thank you. Manuel, you want to add something?
Well, yes. Stigma became a problem so big that the World Health Organization want to address that. And they have a list of recommendations, but I'm going to summarize that in two actions. One is words matter, and the do's and the do not. For example, what you do is you talk about coronavirus. What you do not do is attached locations or ethnicity. So the Wuhan virus, the Asian virus. So I don't know, somebody didn't read that memo from the WHO, but it looks like the things that you can do is, okay, you talk about people who have COVID-19, but you do not talk about, okay, things about, oh, when people die from COVID-19, if they have something, another disease or pre-existing condition, we should not count them as COVID-19 because they will die anyway from the pre-existing condition. So those myths are the ones who create the discrimination. And the second one is do your part. Simple ideas to drive the stigma away. So to use the correct words and do your part.
Okay, thank you. Two last questions, and then we're going to go to the current questions that have come in, but I think these two questions are really important. And Mariana, I'm going to address this one to you. Is there anything that we can do to convince our family and friends who are anti-vaccine to get the vaccine? Is there anything that we can do to convince them?
Yeah, so we have seen all kind of information, right? From the chip to getting infected if you get the vaccine. And I think it is very important to share with our friends and family that there are groups that are anti-vaccine that are dedicated to fabricate misinformation with the goal of discrediting evidence-based facts. And they do it in a systematic way. Some groups have been banned from social media platforms, not for sharing misinformation, but for abusing behavior, like, for example, trolls to disseminate in a non-ethical way. So I would recommend fact checking, going to trusted sources, going to the local health department and other governmental sources like the CDC and the NCI. And I think on our end, we have a lot of work to do to earn that trust. So also relying on community-based organizations that are trusted by communities to spread right information. I think that's key.
Okay, so last question. If my questions are not answered tonight, what can I do? Where can I go to get my questions answered? And I post this to Mariana and Crystal.
Thank you. And I think, again, the health department is a great source of information. And I believe Nicole is going to provide the website to our local health department in Wyandotte County. And they have several sources there that are reliable. And in addition to that, we have other resources. Juntos has reliable information in Spanish for our Spanish speaker community. And also we are working in a website through an effort called Rapid Acceleration, ZRADX up for short. We also have a section with updates there that we can share. And Krista, do you wanna?
Oh yes, just to piggyback off of what you said, information that's available on the website. Also, FaithWorks Connecting for a Healthy Community, having information on our website. And then the people here, I'm not trying to bombard, the doctors here, but your primary care physician, those individuals that you have a relationship with are primary care providers, medical providers, and getting that information. And so as I understand, this information will also be available. I think you already said that through the Wyandotte County Health Department. And the other thing I wanted to also say too, I'll just say this real quickly, Geraldine, that, individuals that may have questions and, for fear, healthcare providers, medical providers, public health personnel are going to keep your information confidential. That's something that, some individuals may say, okay, that's a given, but there are individuals for fear do not want to ask questions. There's no quote dumb question or stupid question. So so just know that that information is out there, and that your questions will be answered.
Okay, great, thank you. I'm looking through the question and answer. I think we've answered some of these. If we have not, someone can point out to me which one we did not answer. Oh, one says the Community Health Council may have the ability to provide N95 masks to the community. Dr. Solano, do you, is that possible?
Yes, and we have many or several. And if you have a specific nonprofit organization, we can help you providing some of them. So please just go to our webpage, contact us, and I will add my email if you want to contact me directly.
Okay, great. To the tech team, were there any, or in the chat, were there any questions that we needed to respond to that I missed, or that our panelists did not address?
There is a question from Sonia below that is in Spanish. So.
Okay. Mariana?
I think I answered the only question that I saw in Spanish. So.
Okay.
There's a question in the chat. Do you believe those who had COVID and were hospitalized will automatically be given vaccination prior to leaving the hospital to prevent their return?
That's
Any
a good one.
hospitalists want to answer that question?
We do, with some vaccines, we try to hit people before they leave the hospital as a way to get that service provided. I'd be curious to hear what Dr. Castro thinks. We would want to wait till somebody had fully recovered and they were probably no longer considered infectious with COVID before we would do something like that. But if we get enough vaccine, we may find that hospitals start to do that kind of thing when a patient is discharged.
Yeah, I agree with Alan. At this point, we don't know how those patients would react to the vaccine because they haven't really been studied. So our recommendation is to wait till you're outside of the quarantine period and then get the vaccine. And so our approach right now is not to vaccinate those that are in the hospital.
Okay. Thank you, Mario. Are there other questions that we need to answer at this time? I do have one that I skipped over, certainly not by accident or on purpose, I should say. It says, I heard that the vaccines are not really designed for Black individuals or people of color because of the differences in the genetic code. And so they're wanting to understand that part of it. So is it not designed for people of color? But then they heard that the vaccine could be amended to work better for people of color. And so Mario, I would address that one to you in terms of people of color and the vaccine.
Sure. In terms of if we think about the virus, it has its own genetic makeup, and that doesn't matter if you're Black, white, or purple, right? And so the vaccine is targeted towards that virus and its DNA. And so the vaccines were not really made for, any particular race. Unfortunately, most medications and many studies that are done are first done in very white people, right? And that leads us to not knowing what to do. And so when Operation Warp Speed rolled out, we actually slowed Operation Warp Speed and said, you have to force the sponsors to help us enroll our minority, ethnic, racial minorities and elderly people. And so that was actually done. We're currently doing that in the AstraZeneca trial. We were only supposed to enroll 30,000 individuals. We're at 32,000. And the whole reason we're still open and enrolling is we're enrolling minorities, and we're enrolling elderly individuals at this point. So, you know, it's not perfect, but we're going to probably get somewhere around 20% of our population from minority, either racial or ethnic, and at least 20% that are elderly. And when you talk about 20% of 30,000 or 40,000, that's a lot of people, and it allows us to understand better if it's going to work in that population. So at this point, I don't believe that there's any evidence that there was anything done to not study this in appropriate populations. It was, I think, just unfortunate part of how many clinical trials are conducted. And you have to work hard, right? You have to work hard at the very beginning to enlist people like Mariana, have been helping us, you know, from the get-go last June and July when we were beginning to launch the vaccine study here. We enlisted their help to get out to our community because we knew this was a big priority for us.
Great, thank you for that. Aaron,
Can I say something? Can I say something?
Sure, Margaret. Just
Joanne?
yeah, sure. 1 second, Margaret. Aaron had a really important comment in the chat, and Aaron, I do think you're the right person to say that because it's really important.
Well, I just wanted to add that, you know, I don't know, when we were talking about the white or black or whatever genetic code, I just wanted to make the point that there's really no difference there. Our bodies don't react differently, you know, and so we think that this is really a vaccine for everyone. And I'm going to kick it over to Margaret because she knows some of the, you know, percentages, for instance, of Black individuals who are in each of these trials. She knows those data really well.
Yeah, actually, I was going to say the same thing that Aaron said, that there is no difference in the genetic code based on race. Race is more of a social construct. It's not a genetic construct. So there, you know, so even though it's important to have people of color in your studies, it's not because of the genetic differences in those people. And certainly, as Mario pointed out, there has been a concerted effort to get people of color into the clinical trials. And for the Moderna vaccine, about 63% were white, 20% were Latinx, and 10% were Black, and about 4% were Asian. So they really made a big effort to do this because people in communities of color have been excluded from these studies in the past. And so I think it's first important to let people know that the genetics are the same of whether you're Black, white, or Asian, and that there have been a variety of races and ethnicities in these trials.
Thank you, Margaret. In terms of sickle cell anemia, I did see that, and I think that's an important one. Margaret, you want to take that? And then I'm going to turn it over to the production team. I think it was related to maybe the vaccine, or if there's concerns about the vaccine and having sickle cell anemia.
And I actually don't know the answer to that question. Okay. I don't think that people with sickle cell anemia have any differences in their immunity, so they should be able to take that, but I'm gonna defer to perhaps Mario for that one, or one of the other people.
Mario?
Yeah, we've included sickle cell patients in our study. At this point, I have not seen anything in specific in relationship to the vaccines in response to sickle cell, but I believe that it should be okay. I mean, there shouldn't be any reason, and certainly they're at increased risk of having crisis with any infection. And so, you know, COVID could trigger a crisis for them, and I would want them to be protected.
Okay, all right, thank you all. Production team?
Thanks for tuning in and being with us tonight. And I'd like to say thank you to Dr. McGee, to all the forum participants for sharing their knowledge and their experience. Thanks to those of you who submitted questions for which I hope you receive answers. Thanks to the leadership and membership team of the Strangers Rest Baptist Church, and especially to our media ministry for their time, their effort, their energy, and the resources that they invested. And finally, thanks to all of you who tuned in. Hopefully, we all benefit from the information and knowledge that we have gained. If you have any additional questions, please check with our website, and that's www.srbckc.org. Thank you and good night.